Welcome back, everyone. I'll be your host for this presentation. That's right, this show is going to be 100% tea burger.
Nicotine replacement therapy. Since nicotine is the siren song of the cigarettes and spit cans, there are many kinds of nicotine replacement therapy that will help you taper off of tobacco. Since this medicine does indeed contain nicotine, it is dangerous to use tobacco while on the therapy. Luckily, nicotine replacement is here to hold your hand. Don't get too attached, though. You should only be on the therapy for about 3 months before quitting tobacco and nicotine altogether. Remember to always ask your doctor which medicine is best for you. Chewing gum or lozenges. Nicotine gum has helped people quit tobacco for 20 years, but that does not mean you should do nicotine gum for 20 years. You can buy the gum or lozenges without a prescription. Just know that it is important to read the instructions on them. You must use them correctly to maximize effectiveness and minimize danger. Also realize that you will be reducing the number of gum or lozenges you use each day. Otherwise, you'll just get addicted to the nicotine in the gum, which can still cause health problems. Let's talk about nicotine patches. Nicotine patches do not require prescriptions. However, it is highly recommended to talk to your doctor about how to use this aid. Remember, your doctor is the lady. Nicotine patches come in different strengths depending on how much tobacco you use, and the packaging has instructions about how to set up your tapering schedule. Don't worry about the structural integrity of the patch. It still stays on, even in water. What an amazing invention! You'll have to remove your patch and replace it with a new one every 16 to 24 hours. It might hinder your ability to sleep, so you probably should not wear it at night. It's also a good idea to change the location of the patch each time you put on a new one. Unlike the previous 2 replacement therapies, the nicotine spray requires a prescription from your doctor. It's a nasal spray that you use once or twice each hour while awake. Although you might experience coughing, a runny nose, or watery eyes at first, there is no need to worry. After a couple of weeks, the side effects will begin to get better. You might need to use this medicine for 6 months instead of 3, but you still need to prepare to quit the spray before your months are up. Before we begin with the section on non-nicotine medications, we must clarify that neither the American Heart Association nor anyone involved with this presentation endorse or recommend any of the brand name medications that will be mentioned. The trade names will only be used to help you identify medications that you may be familiar with. Although bupropion hydrochloride is usually used for depression, it can also help people quit tobacco. Some brand names of bupropion you may recognize are Zyban and Wellbutrin. If you want to save money though, generic bupropion is also available. Varenicline is a somewhat new medication. It's still widely known as Chantix. Varenicline and bupropion have similar properties. They're both pills that alter the flow of chemicals in your brain to neutralize your desire for tobacco. Be patient, though. It takes a week for these medications to take effect. Even though I've said it a few times before, the saying especially applies here. Your doctor is the lady. Make sure she knows about every medication you're taking, even if it's something as simple as a supplement. Bupropion and varenicline may interact with other medications and bring about unwanted effects. Remember what has been mentioned in the previous part of this presentation. Bupropion and varenicline have a possibility to cause unhappy moods such as depression, hostility, and agitation. If you have thoughts of suicide or hurting anyone, then you should stop taking the medication and call a medical expert immediately. Another good idea is to notify your friends and family of the possible side effects so they will know what to watch for while you are taking the medication. Let's talk about electronic cigarettes. You must be 18 or older to purchase e-cigarettes. It is not known whether these devices will help you quit tobacco. However, it seems as though they are less dangerous than tobacco. They still may contain toxic chemicals and nicotine, though. If you use an e-cigarette that has a temperature setting, it is recommended to keep the temperature as low as possible to avoid the chance of unleashing a large amount of harmful chemicals from the oil inside. Hypnotherapy. Hypnotherapy is 100% psychology, 0% fairy dust magic. It is not the same thing as what you see in the movies and on television. In order to be hypnotized, a person must be fully willing to be hypnotized. Also, hypnotists cannot cause people to act like chickens or dogs by snapping their fingers. You should try this therapy for yourself. Hypnotherapy has given some people good results. Keep in mind that a hypnotist cannot make you quit tobacco, but he or she can help you quit tobacco. What it is, man. Do you cats remember what I said in the last part? Now that you've lated that bogue tobacco, you can officially start getting groovier. This whole quitting thing might seem like a real bummer at first, but you gotta realize that it's the exact opposite, man. Like, you'll be able to feel the funk like never before, you know? Just think, blood, you'll be able to go to the movie theater without having to split for a spit or a tobacco-flavored doobie. You can go for an airplane, a train trip without skydiving for squares or like grossing out the other passengers by spitting into a cup. Now, you might find yourself itching for some more tobacco pretty often, but you should totally chill, man. There are like gobs of groovy things you can do instead of tobacco. I'll toss it back over to the narrator to give you the skinny. Keep a list of activities you can do to distract yourself from the urges to use tobacco. At home, you can watch movies or television. You can build or make something. Plant flowers. Take an afternoon nap. Write letters. Look at old family photos or home movies. With other people, you can have a party. See old friends. Join a group. Get involved with local politics. Play with kids or pets. Do volunteer work. Have a picnic in the park. See a new movie. Go to a concert. Go to sporting events. Go shopping. Buy yourself rewards with the money you've saved. Visit auctions or garage sales. Go bird watching. Go to your local garden, zoo, or aquarium. Visit parts of your city you haven't seen for a while. Go fishing. Participate in your favorite outdoor sport. Buy new CDs or DVDs. Have a massage. Visit a farmer's market. Eat a healthy meal at a nice restaurant. Get some good books from the library. Make plans for a vacation. Spend time on a favorite hobby. Whenever you're getting your groove on without tobacco and stop feeling those urges again, just remember your favorite Halloween costume from your favorite decade. Without tobacco in your system, you can start setting time in reverse, man. Let me slide you a little timeline here. After the first month of being tobacco-free, you can boogie all night without getting winded. Your clothes, your body, and your car will smell funky fresh instead of just funky. Speaking of smell, your senses of taste and smell will get their grooves back on like the last train to London's about to split. Those grody stains on your teeth and fingernails will fade, leaving room for such a bright shine you'd think it's a mirror ball in the previous pharaoh's tomb. Get down! Not all the way down to the underworld, though. According to the American Heart Association and the U.S. Surgeon General, this is a timeline of a standard mummy upgrading to a 70s mummy. In the first 20 minutes, your blood pressure and heart rate will lower. After 12 hours, now this only applies to smokers, carbon monoxide levels in your blood return to normal. That one's just for smokers, though. The rest are for everybody, unless otherwise noted. In 2 weeks to 3 months, circulation and lung function will improve. After 1 to 9 months, and this is for smokers, this one is, you begin to cough out the blockage in your lungs, which leads to clearer breathing. After 1 year, risk of coronary heart disease reduces by 50%. And keep in mind, this is reduced from your previous elevated risk that happened because of the tobacco. After 5 years, chances of throat, mouth, esophagus, and bladder cancer are cut in half. Risk of cervical cancer and stroke return to normal. After 10 years, risk of lung cancer is halved. Larynx and pancreatic cancer chances also decrease. They're not quite halved, though. They just decrease a little. After 15 years, risk of coronary heart disease is the same as a non-tobacco user. So after 15 years of not doing tobacco, it's as if you'd never picked up the cigarette or just any kind of tobacco. Oh. It's like you're coming back to life, you know? If quitting tobacco can make you as bomb as I am, then why is it so hard to quit? Why is it so hard to quit? Nicotine naturally exists in tobacco, and your brain will become chemically addicted to it. This drug alters balances within your body to create an artificial feeling of relaxation and stress relief. Once nicotine has stopped casting its spell on your brain, you will begin to crave more of the magic. However, you must realize that this magic will be detrimental to your health. If you use tobacco to relieve stress, then you should consider other options to treat your anxiety. One option is to take a deep breath. It's a good first step. It also helps to breathe clean air instead of smoke. You can go for a walk. Physical activity can improve your mood. Also, consider the walk a mini adventure. That will make it that much more fun. Remember to relax your muscles. Stretch, have a massage, or just lie down and picture a calm scenario. You can talk to friends or just anybody you know. Communicating with friends, family, or counselors about what is bothering you can help you feel better. Whether it's stress from work, school, just any kind of stress, really. Lower your caffeine usage. Although caffeine by itself isn't as bad as nicotine, it does stimulate you. It's a stimulant, and it increases the potential for anxiety, which can lead to tobacco usage. Another thing is to just focus on your health. Focus on your general health. Even something as simple as having a healthy diet can improve emotional status. In order to successfully stay away from tobacco, you have to recognize situations that trigger you to take part in the drug. Do other people who use tobacco tempt you into picking it up again? Does tobacco keep you company when you're lonely? Tobacco does cause weight loss. Do you feel the need to take advantage of this effect? Does it make you feel more confident? Do you have a fidgeting problem or oral fixation that is treated by tobacco to keep your hands or your mouth busy? Is it a side dish for your meals or your drinks? Does it treat boredom while you drive? If driving is too bored for you, then you should try stick shift, man. You won't have enough free hands for a doobie, and even if the cup holder can hold your cup, you'll have to have some boss accuracy to hit it. You are not completely doomed if you encounter a tobacco trigger. There are ways to counteract these situations. If other people tempt you to use tobacco with them, just tell them politely that you are trying to quit, and invite them politely to do the same. If they still use tobacco, and if you cannot help but to join them, then you should spend more time with non-tobacco users, just to get some positive reinforcement. There are many activities you can do other than tobacco. You can go for walks, listen to music, read books, watch movies, play video games, do kung fu, eat a bagel, talk to your cat, talk to a stray cat, handle a snake, eat a bagel, build a robot, or stand too close to an ostrich. Actually, I wouldn't recommend that last one. You could get kicked. Keep your hands and your mouth busy. Fidget spinners and gum were invented for a reason, and that reason is not to make a sticky fidget spinner. Be aware of after-meal urges. Once you've finished a meal, immediately stand up and go do something that isn't tobacco. Fill the ashtrays and cup holders in your car with things that will remind you to stop using tobacco. It could even be something as simple as a note you wrote to yourself that basically says, "Hey, put down that cigarette. Throw away that dip can." You know, just a simple note to yourself. Stay away from smoking areas. This is one of those rare occasions when staying inside is preferable to going outside. Alcohol can lead you back to tobacco use as well. If getting drunk can make you do something as crazy as throwing a rubber chicken at the governor of Vermont, I know this from experience, then doing tobacco is not much of a stretch past that. The path to quitting tobacco might be challenging, but just look at my face to see the results. You'll get your groove on through more Pharaoh's Reigns than you thought possible, and Anubis is going to be miles away. There are more rewards for quitting tobacco than just being as hip as I am. If for some reason you want to learn about those, then boogie on back for part 3. I'll catch you on the flip side. Here's the credits. Educational information was provided by the American Heart Association. Someday I'm going to make a rap out of that. Art, animation, and narration by Justin Ian Miller. Yes, that's me. I also changed the wording of the information from its original form. There were way too many big words in the original booklet. I mean, you guys probably have your own booklet so you can see for yourself. I mean, can you understand most of that? Because even I can't. I had to go to Google Dictionary and such. Oh, also, Clemson Stallion art by Bethany Miller. That's that pretty horse right there. You could probably tell that was made by somebody else because you've seen the stuff I do. I mean, goodness. Well, I will catch you guys next time in part 3. Later. Could even be a note to yourself that's as simple as, hey, quit, goodness, I can't pronounce, I stuttered there. It could even be something as simple as a note you wrote to yourself yes, future me in editing, I hate you. Stay away from smoking areas. This is one of those rare occasions when staying inside is preferable to going outside, for health reasons, because, I mean, there's tons to do inside, you know? I'm a bad influence.